Hello, friends. Most of the time, people want to lose weight, but sometimes you or maybe someone you love has been subjected to unintentional weight loss, and you might be wondering what is going on. So hang with me and we'll get to the bottom of this. And as a reminder, I'm a doctor, but I'm not your doctor, and this is only educational and entertainment, not personalized medical advice. So what exactly is unintentional weight loss? Technically, in the medical community, it's often defined as losing more than 5% of one's weight without trying to do. So for example, if someone was 200 pounds, they might lose 10 pounds unintentionally. Now that might sound great, but it could also be due to depression. So for example, major depressive disorder is a common mood disorder where people feel a lack of enjoyment in things, difficulty motivating themselves, and they lose appetite as part of depression. That's something to consider. In addition, one of the most concerning things that comes to a doctor's mind when somebody's unintentionally losing weight is possibility of cancer or some kind of malignancy somewhere in their body, because the cancer cells start using up much more energy than the body is normally used to consuming, and that often causes unintentional weight loss. And it's often associated with other symptoms like the effects of a mass in the body somewhere. In addition, there could be some kind of weight loss from something called intestinal ischemia, and this is where sometimes people will have a blockage in an artery that goes to their intestines, small or large intestines, and this can often result in weight loss. And typically there are other symptoms associated with this, like bleeding and sometimes cramping pain and nausea. In addition, a very common cause of unintentional weight loss is an overactive thyroid gland, and this is called hyperthyroidism, the hyper meaning too much. This can be easily measured by a simple blood test. In addition, somebody could be just experiencing symptoms of dementia, so you always want to think about that, specifically Alzheimer's dementia, where they've lost motivation to eat, or they have difficulty with their activities of daily living. In addition, we want to always consider something like anorexia nervosa, otherwise known as anorexia, which is a eating disorder that includes a distorted perception of one's body image, as well as a fear of gaining weight. And this can often be life-threatening. And some parts of anorexia could be considered intentional and others considered unintentional, but overall it's something to consider. In addition, somebody could be taking too many of these NSAID medications, non-steroidal anti-inflammatory drugs, things like Motrin or Aleve, and that could be reducing their weight as a side effect. Perhaps due to some inflammation of the stomach lining, which is decreasing their ability to consume food normally. In addition, we want to consider other gastrointestinal disorders that can result in difficulties with processing and absorbing nutrients. For example, a stomach ulcer, which can happen from NSAID use, but also something like malabsorption or pancreatic insufficiency, where the enzymes that normally break down food are not working as well, and the nutrients and calories are not getting into the body. In addition, something like tuberculosis often presents with night sweats and weight loss, and typically people will have respiratory symptoms as well. And many people are carriers for tuberculosis but don't realize it, so it's good to get a tuberculosis test, which is a very easy test to get. In addition, something like alcohol use disorder or alcohol abuse can also contribute to weight loss, because people will tend to prioritize the calories that are coming from alcohol over the nutrients that would normally come from food, especially in the more severe iterations of this disorder. And we can see weight loss as a result, as well as other nutritional deficiencies. So this can be very deadly, but would not be seen with moderate consumption. In addition, we have to always just consider the first step in the eating process, which is, does one's teeth actually work? So perhaps somebody has dentures that are not fitting, or they're having a lot of cavities or infections in their mouth that makes the process of eating aversive. So don't ignore even the most straightforward explanations for weight loss. That's unintentional. Next, we have to consider loneliness, because oftentimes something else could be going on in addition to depression, where somebody is just simply socially isolated and doesn't have the wherewithal or the motivation to go out and buy food, because eating is typically a interpersonal process, a ritual where people bond, and that's the most healthy way to consume food, is with other people in a ritualistic manner. But unfortunately, our Western societies especially have become increasingly subjected to patterns of social interaction where loneliness is more common. And that's one of the downsides of individualistic cultures like America. In addition, we want to consider low socioeconomic status and access to food, which is an obvious explanation, but people often don't consider it. Unintentional weight loss is often seen when people just simply don't have access to calories and healthy calories. In addition, diabetes, when untreated, can cause unintentional weight loss. In fact, one of the most common initial presentations of diabetes, particularly type 1 diabetes, is unintentional weight loss. And this is a result of the metabolic resources being dysregulated because of the way insulin and blood glucose are working in the body in a non-functional manner in diabetes. In addition, we want to think also of medication side effects. So there's so many medications out there that change weight, often causing weight gain, but also causing weight loss. So a common antidepressant medicine called Wellbutrin or bupropion also has as a side effect weight loss. Sometimes people will take this medication because they're depressed and they also want to lose weight, but sometimes they'll just be not wanting to lose weight and will have weight loss as a side effect. We also should consider stimulant medications like Ritalin or Adderall for ADHD or Vyvanse for binge eating disorder. These can produce weight loss, which can be unintentional. In addition, simply having difficulty swallowing, which is called dysphagia, is also a cause of unintentional weight loss because sometimes people have conditions like achalasia where they have a narrowing or a stricture in the gastrointestinal tract that prevents food from passing, or they have some discomfort with consuming food due to masses or infections or other processes in the oropharynx and the esophagus. We also should consider other medications that have side effects like anti-seizure medicines like Topamax or topiramate, which is often given for seizures as well as for mood stabilization and even headaches. This medication has a nice benefit of weight loss when somebody's trying to lose weight, but oftentimes it's unintentional that they'll wind up losing weight. And this medicine is often hard to tolerate due to its other side effects. So thanks so much. I hope this has been helpful. If you want to see more videos like this, please like it or subscribe. I hope this has been helpful for you and your families and those that you love. Thank you so much. Take care.